Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and welcome to our press briefing on Thursday, January the 7th, 2021. This is week 44 of the COVID-19 pandemic here in Montgomery County, and today I'm joined by my fellow commissioner, Commissioner Ken Lawrence. So this is our first COVID-19 press briefing for 2021. And I'm very happy to share that yesterday marked the opening of our first COVID-19 vaccination clinic to vaccinate people who live and work in Montgomery County. You can see some pictures of the site on your screen right now. I want to thank the many people involved in making this happen. This site is at the Montgomery County Community College, and I want to thank President Victoria Bestecki Perez and the Community College Board Chair, Mr. Frank Custer. The college has consistently answered the call during this pandemic, back in the spring by hosting our second drive-through testing site, by providing space and voting locations during the primary and general elections, and now for the launch of our first vaccination site. Our entire community is grateful. Second, I want to thank the quiet heroes in our Office of Public Health and Department of Public Safety. These teams have been fighting this pandemic nonstop for 44 weeks. While much of the work that came before today was to defend our community from the virus, today we take the fight head on to the virus as we begin mass vaccination with a vaccine that is both safe and effective. Right now, we have a very small supply of vaccine. Only people in the Pennsylvania Department of Health defined 1A category will be given appointments to get vaccinated at this clinic. Our best estimate is that the 1A group in Montgomery County is approximately 20,000 individuals. We ask that Montgomery County residents and workers visit our website to learn more about who qualifies under the 1A category. The website is montcopa.org/COVID-19. Once you're on the site, click on the green Vaccine Information button at the top of the page for information about the 1A category and how to submit a pre-screener survey to make a vaccine appointment. Our Office of Public Health is reviewing the responses and will send a registration link to people that fit into the 1A category, and then that will take you to the appointment system. Appointment slots are limited and are available by reservation only. No walk-up registration will be accepted. With our current supply of vaccine, we plan to vaccinate at least 800 people per day. I can share with you that yesterday we were able to vaccinate 861. As long as we have an adequate supply of vaccine, this clinic will operate 5 days a week, Monday through Friday, between the hours of 9 a.m. and 4 p.m. As more vaccine doses become available, more appointment slots and vaccination clinics will be opened. I know that so many in our community, seniors over 75 in particular, are very eager to be vaccinated. We hope to begin to start with the 1B group by the end of the month, but this will depend upon how much vaccine we receive. We ask that everyone have patience as we start this initial rollout. Right now, the demand for vaccinations is greater than our supply. So since our January 5th press release, we have 387 new cases of COVID-19 reported in Montgomery County yesterday, Wednesday, the 6th, and 447 new cases reported today, which brings us to a total of 35,762. These positive cases are a result of a positive test for the virus, not from the antibody test. 17 of these cases were from long-term care facilities, 3 were from other congregate settings, and 814 from our community. 764 of these tests are from the last 7 days or less. 48 tests are from 8 to 14 days ago, and 22 tests are from more than 14 days ago. These positive individuals are from 59 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 3 months old to 102 years old. And as always, you can check our county maps at moncopa.org/COVID-19 for updated geographic information. Today, we have 442 females, 392 males. I am very sorry to confirm that 24 additional Montgomery County residents have lost their life to COVID-19, which brings us to 1,052 deaths confirmed positive from COVID-19. These deaths occurred from November the 17th to January the 6th. This is an increase of 45 reported deaths since last Wednesday. 12 died in the hospital, 8 died in a long-term care facility, and 4 in their residence. They ranged in age from 55 years old to 100 years old. Overall, 547 females and 505 males have lost their life to COVID-19 in the county, and they ranged in age from 34 years old to 104. As you know, we've been reporting the racial breakdown of the individuals that are deceased as we have it as a self-reported measure for that person or reported from a family member. So currently we have 2 American Indian or Alaska Native, 28 Asian, 5 Asian Indian, 4 Asian Korean, 129 African American or Black, 496 white, and 388 unknown. At the Montgomery County Correctional Facility, 1 individual has been hospitalized and is in serious condition at a local hospital. This inmate has been released from custody. All other inmates at the Montgomery County Correctional Facility that have tested positive for COVID-19 are in isolation and stable without symptoms. So some more vaccine update. According to the Pennsylvania Department of Health vaccine website, as of this week, no additional doses of vaccine have been delivered to Montgomery County hospitals. Under the auspices of the Federal Pharmacy Partnership, 20 Montgomery County skilled nursing facilities had CVS or Walgreens host a clinic to administer the first dose of vaccines to residents and staff this week. The county received 3,000 doses of vaccine this week, bringing our total to 7,000 doses of vaccine received. In total, 9,261 partially vaccinated individuals have been entered into the Pennsylvania statewide immunization information system, and 59 fully vaccinated individuals. Of this total, the county has administered approximately 1,500 partial doses as of the end of the day yesterday, and we should administer an additional 850 to 900 doses by the end of the day today. All of these individuals in the county administered cohort are in the 1A. So let's move on to our positivity rate. Our positivity rate has ticked downward again this week. Our 14-day average positivity rate is 10.4% as of Friday, January the 1st, compared with 10.53% as of Friday, December the 25th. As a reminder, a positivity rate below 5% is considered suppression of the virus. This graph showing the daily positivity rates from December 19th to January the 1st shows that the county is above 5% on all 14 of these days. And I do anticipate, given the numbers of positive cases that we've seen this week, that our positivity rate is likely to tick back up next week. As mentioned earlier, our hospitalizations continue to remain high, but they have improved slightly since last Wednesday. Today, we have 429 individuals with COVID-19 hospitalized in a Montgomery County hospital. This is slightly decreased from 438 last week. 11% or 47 of these individuals are requiring a ventilator. As we're seeing our positive case numbers increase over the last several days, I do anticipate that our hospitalization numbers will also increase over the next week to 10 days. As a reminder, we do have the hospitalization information and also the daily ventilator use on our data hub at montcopa.org/COVID-19. For the 14-day period ending January the 1st, 52,226 Montgomery County residents were tested for COVID-19, which is a decrease of 2,069 people tested compared with the 14-day period ending December the 25th. When we look at our date tested graph, you can see the results of all of that testing. And as a reminder, the gray bars are the number of positive cases on that given day. The red line is the 7-day average of total cases. And that means the cases from the community, long-term care facilities, and any other congregate settings like the correctional facility. And the pink line is the 14-day average of total cases. The dark blue line is the 7-day average of community-only cases. The light blue line is the 14-day average of community-only cases. And then down at the bottom, the orange and yellow are the 7-day average of long-term care facility-only cases and 14-day average of long-term care facility-only cases. So next, we'll zoom in to the last 10 weeks. And what I just want to point out to everyone is while the 14-day averages are still moving downward, the 7-day averages are starting to tick upward, which likely reflects the beginning of a post-holiday surge. And of course, this is as of last Friday. And so none of the numbers that we've seen this week, which is now, I think, 3 days of well over 400 cases each day, are reflected in this graph today. Also, it's time for our monthly presentation of our age cohort chart. So as a reminder, in the left column, it shows the census tract age cohorts, followed by, in the next column, the percent of our population that age cohort represents. The next columns, beginning with April 1st, show the percent of cases within each of these age cohorts and whether they have been increasing, which are in red, or decreasing, which are in green, compared with the prior month. You can see over time that older individuals continue to be a smaller share of our cases and younger people a higher share. I am pleased to see that we are seeing a decrease in the 15 to 19-year-old and the 20 to 24-year-old cohorts, but I want to point out that both of these age groups remain overrepresented relative to their share of the population. Also note that cases are increasing in those that are 14 years of age and younger, and in those between 25 and 64 years old. We continue to have good availability of testing, and as always, I want to urge anyone who wants or needs to be tested to get tested. Our testing sites are back to their normal pre-holiday hours, meaning that they're open Monday through Friday, varying hours each day. This Saturday, January the 9th, the Willow Grove site will be open from 9 a.m. to 1 p.m. Registration for this site will open online at 7 p.m. tomorrow evening, Friday, January the 8th. And again, that's for Saturday testing at the Willow Grove site only. As a reminder, if you know that you've been exposed to COVID-19, you should self-quarantine. If you would like to be tested, you need to wait until 5 days have passed since the exposure. Getting tested more quickly than that will not be reliable. If you test negative after 5 days, have not had any symptoms of COVID-19, and have not had ongoing exposure to someone with COVID-19, then your quarantine ends on the 8th day after exposure. To register for a test, you can go online at www.montcopa.org countytesting.org/COVID-19. Click on the green County Testing Information button located at the top of the page, and all of the information about each site and the hours that they are open will be on that page. Appointments open online at 7 a.m. on the day of testing. You can also register by phone, and that phone number is 610-970-2937. And phone registration for all of our sites opens at 8:30 a.m. on the day of testing. Just as a reminder, you cannot book ahead for testing. And the phone line does have language line available, multiple languages, so individuals can make an appointment in the language with which they feel most comfortable. Remember, we remain in a very serious and evolving situation. Together, we have the power to keep this virus in check while we await the arrival of enough vaccine in our community to vaccinate everyone who would like to be vaccinated. In the meantime, remember the 3 W's: wear your mask, wash your hands, and watch your distance. And I have just one announcement today, which is about our Mako Strong 2021 Restaurant Grant Program. This is the final reminder that the grant program applications close tomorrow, January the 8th at noon. The Montgomery County Board of Commissioners has made available $5 million in county economic development funds to support restaurants and other food service businesses. Grants of $10,000 will be awarded to each qualifying business. Eligible applicants must be a for-profit restaurant, food truck, deli, bakery, brewery, distillery, vineyard, caterer, or other food service for-profit entity with a physical location in Montgomery County. And you need to have been in operation since at least January the 1st, 2020. Obviously, this grant is geared at operations or restaurants that have experienced disruption due to the COVID-19 pandemic, and there are several other criteria listed on the application site. Again, these applications close tomorrow at noon. However, these awards are not given on a first-come, first-served basis, so if you haven't applied yet, you still have time. Please note that applicant entities that have been ordered closed for any public health violation by the Montgomery County Office of Public Health, including any issues related to the spread of COVID-19, or have willfully violated all lawful COVID-19 mitigation orders issued by the Commonwealth of Pennsylvania since January the 1st, 2020, may not apply. This program is being jointly administered by the Montgomery County Commerce Department and the Redevelopment Authority of Montgomery County. Information and links to apply are at www.montcopa.org/commerce. COMMERCE. And with that, I will announce that our next virtual briefing will be Wednesday, January the 13th, and I'm happy to take any questions.
We'll start our questions this afternoon with Bethany Au from the Philadelphia Inquirer.
Hi, Dr. Arkush. I have 2 questions. The first one is, do you think that looking at the number of doses given of the vaccine versus the number that's been delivered to the county or the state is a fair estimate of how well the vaccine rollout is going in Montgomery County? And the second question I have is there a system in the works to notify people who are not part of this 1A group when they are eligible to get the vaccine?
Yeah. Great questions. So for your first question, I would say that in about a week or 2, I think it'll be comparing how many doses have been received to how many doses have been given will be a good gauge of how things are going. Right now, it's been a pretty fluid situation because the majority of the vaccine that's come into the county has actually gone to our hospitals. And so we don't have any control over how that is being administered. And our county mass vaccination site just opened yesterday, as you heard. So, our hope is that we will have a very steady minimum of 800 people vaccinated at our county site as of yesterday. We actually can go up to a higher number than that, but we are going to very quickly go through the vaccine that we have. And we do not have certainty about how much vaccine we are going to receive from week to week. So we don't want to give people appointments and then have to call them up and tell them that we don't have vaccine for them. So I think in about another week, we'll have a much better sense of the flow of this and kind of what we can start to consistently expect here in the county. And then in terms of getting to 1B, so as I mentioned earlier, we think we have about 20,000 people in the 1A category here in the county, and we will go as quickly as we can to get those people vaccinated, again, fully dependent on the amount of vaccine that we receive. As we start to move into 1B, we have already done some outreach to a number of entities. For instance, we have reached out to our public school system. They are putting together numbers for us of their teachers and other staff in their school buildings. We're reaching out to independent schools to do the same. We have numbers for how many police and firefighters are in the county. We've reached out to organizations like Limerick Generating Station and PICO and Aqua. So there's quite a bit of work that's already being done in terms of reaching out to the entities whose workers are in 1B. We've also taken a look at our census data, and we know from the 2018 census that there are approximately 66,600 people in Montgomery County, at least in 2018, that were 75 years of age or older. And so reaching out to them is going to be a little more complicated, and we are working on exactly how we're going to do that. But once we have a little more certainty about when we'll be able to start with the 1B group, we will begin that outreach much more directly.
Thank you.
Mm-hmm.
Next, we'll go to Carl Hessler from the Pottstown Mercury.
Good afternoon, Commissioner. One question: when will you be able to better determine where you will have some other satellite vaccination clinics? What the determination in that? What point must you get to in order to say, oh, we're going to have some other clinics, perhaps in Lansdale or Pottstown?
Mm-hmm. The biggest determinant of that is going to be getting more vaccine. Right now, we've got enough to get us through a few days. But if you do the math, we only got 3,000 doses this week. We've received a total of 7,000. We've already given 1,500 of it, and that was by the end of the day yesterday. By the end of the day today, we should have given almost 2,500 doses of it. So we just don't have that much vaccine. And so if we continue to give 800 or 900 doses a day at our mass vaccination site, and we only get another 3,000 doses next week, we'll be done with that by the end of next week or maybe the following. So it's all going to depend on when we get a higher volume of vaccine. We asked for 5,000 doses for this week, and we received 3,000 doses. So we are asking for the maximum amount that our team is told we can ask for, but that doesn't mean that we're going to receive it. So there's really no point in our opening up another site because it's a significant issue in terms of setting it up and providing the appropriately trained staff and all of that to only be able to give out a few hundred doses of vaccine. So our hope is that we're going to soon get much larger weekly shipments of vaccine, and then we could open up another site that we hope would also do, at least 1,000 people a day.
Okay, and could you just review one more time who is eligible in the 1B category?
1B.
Yeah.
So I would, first direct folks to our website that I mentioned earlier. It's a link off of our main data page, and there's a whole description that you can click on about 1B. We are following the Pennsylvania Department of Health's vaccine plan, and so there's a very detailed description of that 1B group also on their website. But generally speaking, it is police and firefighters. It is teachers, grocery store workers, people who work in critical utilities, like, the electric company, the water companies, the Limerick generating station, individuals who work at manufacturing companies that are making PPE or any of the components that are being used in the vaccine manufacturer. And that could be, the actual drug components, or that could be things like syringes, needles, that sort of thing. So any manufacturing that is part of the response to the COVID vaccine is in that cohort. There are other groups like clergy. There's many others, but those are the ones that come to my top of mind right now.
Okay. Thank you very much. That's all I have.
Okay.
Next, we'll go to Deanna Durante from NBC 10.
Hello. I know that you've answered a lot of the questions that we had from you yesterday, so I just have a few quick follow-ups from that. Today, I was able to get into the Zoom with Dr. Levine and did ask her about your point of, we can set this up, we have this infrastructure, so should Montgomery County get more, or counties like Montgomery County get more of the state's allotment? And she said that she is in talks with Montgomery County, that she's talking specifically to you, to try and increase the amount of doses that you're getting. How's that going? Because that's all she would say.
I don't have much else to report. Thank you for asking. And I don't have much else to report. We did have a conversation. I had a conversation yesterday with her office, and primarily to update them on our mass vaccination site and give them a report that it was now actually up and running and how things went yesterday. So, I think it's always important that once these things are actually stood up and working, that we share that information with the Secretary's office. And, we talked through some thoughts about possibly getting more vaccine here. I do want to share with people that the states, just as our number might fluctuate from week to week, the state is told by Operation Warp Speed how much vaccine Pennsylvania is going to get, and on any given week, and that number sometimes changes. So we're all in a it's a little bit squishy in terms of these numbers, which is extremely frustrating, and it makes it very hard to plan. But I have, made it clear to the Secretary that we're up and running here, and anything that they can give us, we will put to good use right away.
And when you talked about the numbers of 9,261 were entered into the statewide database, are those Montgomery County residents? Because the 800 or so that were vaccinated yesterday are from Montgomery County, but also live in other counties as well.
Right.
So
those are not all Montgomery County residents, I don't believe. I believe those are the doses that have been given in this county, but we can double check that with DOH. That's actually their website. So we will follow up with you on that. But I can tell you philosophically that we're all trying to create what I've taken to calling bubbles of security. So in other words, a hospital wants to vaccinate all of their employees, whether they live in Bucks or Philly or Chester or Delco. If they work in a Monco hospital, that hospital wants to get all those folks vaccinated so that hospital is a bubble of security. And that's the approach that we're taking at the county as well. Just think about a home healthcare agency. It does no good if only some of that workforce is vaccinated because they don't happen to live in the county. So we're vaccinating people who live or work in the county within that 1A cohort. And the hospitals are doing that as well.
So that is going to the hospitals there. So the hospitals were given their primary dose. And do we know if the hospitals in Montgomery County used all that up, or did they hold on to it to then give that second dose to their workers? Is there a way to track?
I believe they have largely used it. We've all been told the same thing, which is that if we received 1,000 doses, I'm making up dates, but on January the 5th, then in our case, because we have Moderna, 28 days later, we're going to get another 1,000 doses for those people that were from that January 5th date is how they're doing it. And so, for instance, at our vaccination site, we're making that second appointment for every single person that we're vaccinating. And we've been told that we don't have to hold vaccine back, that we will get additional shipments for that second dose. And that's what the hospitals are doing as well.
But we aren't sure of that they did do that, because I've been told some health systems did hold back to make sure that they would be able to give that second dose. I've also been told there's nothing wrong with that, but that does account for unused doses that then are sitting on a shelf.
Potentially it could. You would have to check with each of the hospital systems to find out specifically what they're doing.
Any plans for the county to ask the state, once you get to that 1B, to have school nurses vaccinate the teachers and staff inside schools, or is it the county's plan to have them go through a county site?
Well, at this point, we're planning to have them go through a county site because the handling requirements of this vaccine are quite unusual. And so there's a couple things that are different about this vaccine than a flu shot, which, everyone is probably much more familiar with. First of all, it has to be thawed. Once it's thawed, the clock starts ticking on that particular vial of vaccine. For the Moderna vaccine, I believe we have 30 days from when it's thawed. Then, once you put the needle through the vial for the first time, through that rubber stopper in the vial, we have 6 hours to use up that entire vial. And our goal is not to waste a single dose. So it would be quite complicated to make sure that a school had exactly the right number of doses so that none of them were wasted and that they were given within that 6-hour time period once they gave that first dose. And then the other thing that's different about this vaccine compared to the flu vaccine is that people need to be watched for 15 minutes. There's been an extremely rare, I saw some data this morning that's suggesting it's about one person out of every 100,000 people. So it's very rare, but there are some people having an allergic reaction to this vaccine. So in an abundance of caution, we're watching people for 15 minutes. For instance, at our vaccine site, we have any medications that would be needed to treat an allergic reaction. So all of that makes it a little more complicated than, for instance, giving the flu shot at a school. So for now, the plan is to have people come through mass vaccination sites.
Thank you.
Mm-hmm.
I'll just open it up to our other reporters on the line. If any of you have a follow-up question, please indicate your desire to ask it by raising your hand in WebEx or by taking yourself off of mute. Okay, seeing none, that concludes our questions for today.
Great. Thank you. Thank you, Joy. See everyone next week.